There are mounting concerns about a midsummer coronavirus surge in the U.S. The Delta variant is fueling an increase in cases nationwide. Average daily infections have more than doubled in just 3 weeks, while vaccinations stumble once again. The climbing numbers appear to have spooked investors Monday, with the Dow seeing its highest percentage loss since last October. Meanwhile, the American Academy of Pediatrics has put out its guidance for the new school year. It's now recommending all students of all ages wear masks. David Begnaud begins our coverage in Arkansas.
Elaine, good evening. Arkansas leads the nation when it comes to COVID hospitalizations on a per capita basis. You know what the average age for a COVID patient inside this Little Rock hospital is right now? 40. You know what it was 6 months ago? 60. The experts were just telling us people are walking into this hospital younger and sicker than ever before, and they believe much of it is being driven by that Delta variant. Tonight, COVID is surging in Arkansas for the third time.
It's hard to breathe, so I have to have oxygen.
The number of hospitalizations has nearly tripled just in the past month.
I regret it, not getting the COVID vaccination.
I thought I couldn't catch it, so I just went on by my daily life.
Arkansas has the nation's third worst vaccination rate, and now it's overwhelmed by the far more contagious Delta variant, which is showing up in 84% of all new COVID cases.
For most people who get this Delta variant, it's going to be the most serious virus that they get in their lifetime.
Tonight, there is new guidance from the American Academy of Pediatrics recommending that masks be worn in schools, even if adults and students have been vaccinated. That contradicts the CDC that says fully vaccinated students and teachers do not need to wear masks on campus. Also today, the government of the United Kingdom lifted most COVID restrictions, despite cases skyrocketing to levels not seen since the worst of the pandemic. And now the CDC has issued a warning, urging Americans to avoid all non-essential travel to the United Kingdom. Back here in the state of Arkansas, it's a race between the vaccine and the variant.
We've got over 50 people in our hospital right now with complications of COVID-19. We've got 0 people in our hospital right now with complications from the vaccine.
What problem would it cause for you to get the vaccine?
For one, I'm not going to, because I don't trust the technology.
Where do you get your news from?
I get it from alternative news sources.
A CBS News YouGov poll found that among those vaccinated, 74% say they will not get immunized, even if their own doctor recommends the vaccine. Are people just not listening to you?
I think we need to do a better job. Help me to understand who would convince you, and I will find that person and we will talk to you.
As the cases surge here in Arkansas starting next week, there's a new law that goes into effect which will ban any government officials from implementing more mask mandates. Local mayors can't do it. Heck, the governor can't even do it if he wants. The state legislature has banned it, even if the experts and doctors say that's what's needed. Elaine, back to you.
David Begnaud, thank you. For more, let's bring in Dr. Jeremy Faust. He's an attending physician in the Department of Emergency Medicine at Brigham and Women's Hospital. He's also an instructor at Harvard Medical School. Dr. Faust, welcome. Thanks very much for being with us. Daily coronavirus infections in the U.S. have more than doubled in the last 3 weeks. At this rate, what can we expect to see in the coming month? And do you believe we could soon see new restrictions across the nation?
Thanks for having me. I think that the more people pretend like this is not a problem, the higher case counts are going to continue to be. We were able to remove a lot of these restrictions with the caveat that was saying, look, if there's vaccination, we don't have to wear masks. But I think people have been a little fast and loose with that. I think that they sort of heard that and said, well, if enough people around me are vaccinated, I don't have to be vaccinated. I don't need to wear a mask. And what's going to happen? Well, we're seeing what's happening with that. It's really a divide in this country at this point. For people who are vaccinated, they have an incredible amount of protection, even from Delta. We're going to see more and more data in the coming days about this. For those who are not vaccinated, it's worse than ever before. I believe this would be happening right now if it weren't, even without Delta. But Delta just makes it that much more punishing.
And on that point, the former head of the FDA says the Delta variant is so contagious, it will infect the majority of people who haven't been vaccinated or previously infected. Now, he adds that for most people, it would be the, quote, most serious virus that they get in their lifetime. What do you say to that?
I think he's right. Look, even people who have full vaccination status can get this virus, and a very small number of them will be hospitalized, and so we will eventually see the numbers pick up because of that. But even among people who are vaccinated and have what's called a mild case, it will hit them very hard. I'll give you an example. You can lose your you can lose your taste and your smell, and you can have a fever and body aches for more than a week, and that's called a mild case. You only get to moderate or severe when your oxygen levels drop. So you can be really laid out and miserable and still be a mild case. And quite frankly, those mild cases aren't what's driving deaths. They aren't driving long-term disability for most cases. But it's really disruptive. Talk about days of missed work, childcare, and the fear factor. So even if you're lucky to get a mild case of this virus, it's no fun. At the same time, the numbers are still high, that the hospitalizations and deaths are also something that we're really worried about. Fortunately, for most of us who are vaccinated, those numbers are now stacked in our favor.
That's, I think, one of the first times, Doctor, I've heard it sort of defined that way. What does a quote-unquote mild case consist of? I'm not sure that a lot of people would have necessarily thought about all of those symptoms being a result of a quote-unquote mild case. On another topic, children have been missing out on routine vaccinations due to the pandemic. And as we await a COVID vaccine for kids younger than 12 years old, what are the biggest threats to children's health right now?
Well, first of all, I want to point out that coronavirus, COVID-19, looks to be the deadliest infection that's widespread that we have had in this country in a long time. Look, it doesn't, the individual fatality rate is much, much lower than for something like meningitis or measles or Ebola or something like that. But this virus is so contagious that it's widespread. And so therefore, we've had 300-400 deaths of kids in the United States this year. And that came at a time when we did so much mitigation that we cut our influenza deaths in kids from the usual, which if you really look at the specific stats, not the estimates, but the number of counted deaths in kids every year, we cut that by more than tenfold. Usually 150 to 200 kids die a year of flu, which is a very high and scary number when you're a parent. But on a population level, it's very rare. Last year we had fewer than 10 because of masks and closures and everything else we did. At the same time, COVID killed 300 or 400 kids, and I worried that if we let this sweep through the kids, you would see 3 or 4 times that many deaths. So that's number one. Is COVID is for the kids, yes, far safer than for adults, but still a real menace. As for the pediatric vaccinations in general, we have to really be on top of that because there are other viruses that are in the background that will eventually, start to crop up if we're not careful.
Yeah, I mean, it's pretty remarkable, though, to hear those numbers because I think, you're right, for parents out there hearing the relatively rare cases in the population, intellectually, that's one thing, but as a parent, that is certainly very frightening. Well, now the American Academy of Pediatrics is recommending that everyone over the age of 2 wear masks in school this fall, regardless of vaccination status. Why is that, doctor? And what is your take on mask use at this point in the pandemic?
Well, first of all, you always have to look at any intervention, whether it's a shot, a medicine, or something like a mask, and you ask what is the risk and what is the benefit. And something like a mask could have, we don't even really know, right? But it could have a small benefit. It probably has some small benefit, but the risk is basically Zippo. Any sort of panic around that is pure fake news. And we've seen studies that were retracted around this. I mean, it's been a real mess. So to me, there's a low cost of asking people, including kids, most kids, to mask. And I was pleasantly surprised. I'm a parent. My now 3-year-old has no problem with her mask. She kind of takes it or leaves it at this point. I was worried that she'd have trouble with it. And so I'm not saying every kid's alike, but a lot of people, a lot of kids can do this. And I think that the thing with the American Academy of Pediatrics is they figure they have one sentence. They're not going to get 2 or 3 sentences in. They're not going to say, okay, if you're vaccinated and this and that, you can or can't wear a mask. They just know that one message can be heard. And so given that they have sort of one chance to say something, I think they've looked at the tea leaves and said, look, vaccination rates are going to be low enough in the whole population, and certainly in the kids who aren't yet eligible, that it just makes more sense for now to keep those masks on, especially because the downside is so minimal.
Well, we know the Tokyo Olympics are set to begin on Friday. Tennis star Coco Gauff will not compete after testing positive for COVID. Despite this, most athletes are vaccinated and there will be no spectators. Still, some fear the games could turn into a super spreader event. How concerned are you about this?
Okay, I'm going to take a slightly contrarian view on this. The entire planet is a super spreader event right now. There is not a safe place to go. Yes, in the places with 90–95% vaccination, it's far, far safer than the places that were in the segment where it's less than half. Okay, but the Olympic Village itself is probably one of the safer places on earth because they have daily testing of every single person who walks in there. They have higher vaccination rates than the Japanese public. They have higher vaccination rates than the population from the countries from which everyone is coming. I mean, even from the United States, you would think that the athletes and the staff that arrive in Tokyo, that's a group that's more vaccinated than the average American. So in my view, you could have outbreaks or a little bit of spread in the village, but in fact, it's probably a relatively safe place. Look, right now in the world, it's 15 cases per 100,000 people. In the Olympic Village, it's like a couple out of 80,000. So it's really, really a lot lower. Now, that's not to say that they couldn't get out of control. They could screw this up. They have the ability it can go any which way. But at the moment, the idea that Tokyo is for some reason worse off because of an international presence, that doesn't work for me because honestly, I worry about places like the American South where we're not doing anything. We're not testing anyone. We're not wearing masks. The vaccination rate isn't going up. In Japan, all those things are happening, including the vaccination rate, which has been a little slow, but has actually really increased lately. So look, I think there could be problems, but I don't think it's really destined to be a big failure. In a few cases is not the same thing as hospitalization. So if they catch some cases and isolate them, they could really be showing us, quote unquote, how to do it. And that would be really nice to see, but we're watching carefully.
Yes, we are. Dr. Jeremy Faust. Doctor, thanks so much for sharing your perspective and expertise with us. We really appreciate it.
Thank you.